Thank you so much for keeping it K24. This is what we do every weekday from 6 a.m. to 9 a.m. My name is K24, and thank you so much for talking to us on our social media platforms. By the way, we do appreciate your feedback. We even appreciate your salams. Why don't you just say hello to us through our Facebook, Twitter, and Instagram accounts, and we'll really appreciate it. And of course, our digital team continues to monitor and of course to respond to some of the questions and the queries that you may have. So keep them coming. Also, a big thank you to our governor from Laikipia for coming through this morning on Up Close and Personal. I absolutely love what he said, that, by the way, leadership is about making ordinary people do extraordinary things. What a fantastic individual. All right, my name is K24, and welcome to another session of Health and Wellness. If you tend to put off your annual checkup at the dentist, well, trust me, you are not alone. It's actually quite common for people to go for years without seeing a dentist. Needless to say, this show is for you. We are going to be talking about the importance about adopting good dental habits, how to tackle common dental problems, and even how to improve your brushing techniques. Yes, you may actually be doing it wrong. Today, we are teaming up with the Royal Smiles Dental Clinic, who turned 5 years old this week and are spreading dental education in different counties. Dr. Gladys Maina is here to tell us how to achieve a brighter and whiter smile. Dr. Gladys, welcome.
Thank you.
We're so happy to have you. And should I start off by saying happy birthday to you and the team?
Thank you, Shiko.
5 years, well done. Okay, so let's start off with the perceptions that people really have about your practice and even you as a doctor, or at least dentists in general. There's this fear that we have because when we talk about someone not actually going to the dentist for years, the perception is crazy out there.
Yes. It's quite alarming because most people have this perception that dental care is synonymous with pain, that you show up at a dentist and the first thing you're going to encounter is pain, very long needles, long procedures, scary procedures. Yeah. But imagine it's not. Yeah. It's just, it's something that we should adopt and take in with us. Same way we encourage each other to do annual medical checkups. A visit to a dentist should not be one of those things we put off until we're in a pain crisis, which unfortunately is what majority of us do, including some of us, the practitioners. Oh, wow. We tend to put off a visit to the dentist until we can't anymore, simply because we imagine we are going to be in so much pain and distress and discomfort, not knowing that actually avoiding to visit a dentist, you are probably staying off with a situation that's likely to get worse as opposed to if you go early. So yes, there's this fear, but we are here to demystify it. Dentists are very friendly, very warm,
not deadly,
very gentle. And you actually get out of a dentist's office most times happy, better health, a better smile, and feeling fresh and clean.
Well, just to add on to that point, I was actually with Dr. on, was it Friday?
Yes.
By the way, you're right, very gentle, and thank you so much, because I actually did go in for at least a cleaning, and we managed to do a filling. But what I would imagine that goes through people's minds, and you can't really blame them, is the fear comes in, especially when you're actually just asking for the tools that you need to perform whatever it is that you're doing. So, when someone hears mirror, retractor, probe, I think you have something called like an excavator. I mean, when you hear such words, you're like, what is going to happen, And so people imagine there's drilling, there's all that happens. So how do you go about actually helping people feel at ease at your clinic, for example?
It actually starts at the front office, right at the door. When you come in, there's someone to welcome you with a smile, get to know you before we actually get to understand what your dental issues are. They'll talk to you nicely, smile at you, get to know how your welfare is, then engage you to just calm you down. If you're really nervous, we allow you to even have a seat. You can have a cup of tea, have a cup of coffee. Just as you're chilling and waiting, then as you walk in, we have a team of very warm team that will welcome you.
So all this is what you actually train your customer relations team to do. Because you understand when people get to your chair, all hell is going to break loose in their minds. So do you see like full-blown adults literally terrified.
On a daily.
Okay.
Yes.
All right.
Yes,
So
yes.
anyway, let's talk a little bit about poor dental habits that you see. What do people ideally do on a day-to-day basis that could be making their situations worse when it comes to their teeth?
It starts with something as basic as cleaning your teeth. Most people don't know how to clean.
Yeah.
And believe it or not, there's a majority of adult human beings who have never brushed their teeth.
Really? So what are we doing? Just our own things.
There are people who are doing their own things.
Yeah.
There are people who are trying, and there are people who are unbothered at all, I have encountered adults who have never, ever brushed their teeth.
Wow.
Yes.
Okay.
So it starts with not brushing or brushing and not doing it well. Brushing and not doing it enough times. We advocate that you brush at least twice a day, in the morning after breakfast and the last thing before you get into bed.
Yeah.
Most people brush once a day, but question is, how well do you do it? So if you're doing it really, really well, once a day you can pass with it.
Right.
But most often we say twice a day. The other thing is our dietary habits. Most people, and also because of the busy lifestyles that we have adopted, we tend to go for the fast foods, highly foods that are rich in sugars, carbonated drinks, things that are quick to consume.
Yeah.
But we don't take into consideration, we don't even think about what that entails or what that means to our dental health. Most people think that taking fruits and vegetables is for a certain group of people.
Right.
We should all be aiming to take fresh fruits and vegetables in large quantities. Habits like smoking, it could be tobacco products, non-tobacco products.
Yeah.
Chewing things like cats, that's mirror. Those are also bad dental habits.
Right.
Yes,
yeah.
yes,
And
yes.
you do see that a lot. You know, when you actually talk about what sugar does to our teeth, maybe you can help us kind of visualize how our teeth are actually breaking down when we, you know, don't take the necessary steps to clean our teeth properly. So what's ideally happening when you decide, okay, I'm just going to go to bed without brushing my teeth?
First of all, what happens is that the molecules in sugar and also the contents of our saliva and other food particles, they will just form a thin layer that will be on the surface of our teeth. That will remain there for some time. Usually when we're brushing, that's what we remove. We call it plaque. Yeah. And then, of course, our mouths have a whole colony of bacteria, different types of bacteria. So now these bacteria use sugar as their main source of energy. So as they are working on the sugars, there's the byproducts, the acids that now will be left on our teeth surfaces, assuming we did not clean. So what that means is, as hard as the tooth enamel is, this acid is at a high concentrated level. So that means that it's going to break down the structures that make up the tooth. Yeah. So it starts, most times it starts as a small pin, a very small area. Yeah. Then if you don't clean and the bacteria keep accumulating food particles, then you're just creating a small microenvironment where the food degradation, the byproducts will keep now working on the teeth. When it spreads out, and we actually know that the enamel is the hardest part of the human body. So now if you have all these acids working on it over a period of time, the saliva, you keep adding more and more. So eventually, as hard as it is, it starts softening. So as it softens, it gets deeper into the tooth, to the area which we call the dentine. That's the softest part of the tooth. Once the decay and all these byproducts have gotten there, then the spread becomes faster. Something that started as a very small area becomes a large cavity in a period of time. Then when you get there now, then we start having issues like sensitivity. If that's not sorted out, now you progress to mild pain, moderate up to severe pain.
And before you know it, your tooth just falls off.
Before you know it, your tooth falls off, or you can't even sleep, you have infections. You know, it's just a cascade of events.
Wow. Okay. Yes. So let me just rope in our audience at this particular point. If you do have any questions concerning your teeth and, of course, oral hygiene, why don't you talk to us this morning? Daktari is here to answer some of your questions. And, of course, we are active on social media as we speak at K24TV on Instagram, Facebook, and Twitter. But if you prefer to call, by the way, we'd love to hear your voice this morning. Our numbers are at the bottom of your screen. Now, Doc, you know, there's been lots of debate over the years about fluoride. And a lot of us don't really understand that fluoride is important to the health of our teeth. And why don't you explain a little bit about that? And also, there's that belief that people who have been born and raised in rural areas tend to have too much exposure to fluoride, hence why you will see a lot of stained teeth, you know, in so many individuals. But I don't know, how true is that? Why don't you give us the facts in regards to fluoride?
Okay, fluoride is one of the essential components that form up the tooth structure.
Okay.
So it's very important because the tooth structure is formed up of several, what do you call, elements, yeah? So fluoride is one of them. It's important in the sense that it like forms a mesh with the rest of the elements that form the tooth structure. Yeah. And it contributes to generally the structure of the tooth in a process we call mineralization. That's not the minerals coming together to form up the component that is now the tooth structure. Yeah. So fluoride is very important because it helps to protect the teeth against decay and cavities. But now that means that, of course, there are certain limits or levels to how much fluoride is important. Beyond a certain limit, then it becomes something that's not causing a positive effect. Yeah. And so now, if you have excess fluoride, especially in water, in some regions of in some areas, especially in areas where we use borehole water, then you tend to have more than is required to form the tooth structure and also to form the bones. Right. So when you have it in excess, this whole process for forming the minerals of the tooth, then it becomes altered in a negative way. Right. So in most cases, what we will see in teeth, it starts off as a very chalky white appearance on the teeth. Okay. Then with time now, there's also be some small pits and fissures on the teeth now that will form as a result of that disruption in the chemical composition of teeth. Right. Then because of the foods and drinks that we consume, there'll be staining in those areas. And you see, this is the main structure of the tooth. Right. So as the tooth is forming, its structure is not normal. So now these stains get incorporated into the structure of the tooth. And now the end result is you will have people with teeth that appear chocolate brown. Right. Others are not so brown. Others are almost yellowish. Yeah. So the discoloration varies depending, of course, also on amounts of fluoride ingested. Right. Then in very severe cases, there's, it could also appear in our bones. It's something we call skeletal fluorosis, but that's not as common as the dental fluorosis. Okay. Yeah. Okay. So, and there's definitely, if it's something that's available in our foods, in our waters, that means it can be traced and that can be controlled. Okay. That's usually a gap that exists. Most people don't know that. Yeah. You can actually tell the amount of fluoride levels in your water. Oh, really? Okay. Yes. Okay. Yes. You involve the government chemists. They can test your waters and tell you the various mineral contents in your water and the levels at which they are at. Yeah, and you see, I think that really does answer, you know, a lot of questions as to why someone has, you know, generally stained teeth across, not just one or two teeth, but you're actually talking about the entire set of teeth. And it now educates a lot of people in terms of, oh, okay, fine, so I need to check how much fluoride, you know, we are consuming in this household. Because people will say, okay, fine, it's just because they have poor habits, but it's not that. You're actually taking in too much of this mineral. True, true. Okay. And the funniest thing is that there's a prosthodontist in America known as Dr. Thomas Salinas, who was actually talking about tooth decay becoming an epidemic because children today have the highest level of decay due to poor fluoride exposure. So now here we have city kids who are not getting enough fluoride. So what do you, would you say to even parents who are in urban centers? Is it that when you're picking a toothpaste, that is the key ingredient you need to be looking out for? Well, fluoride in toothpaste is a key ingredient. It's actually one of the ways that governments all world over, especially in areas where fluoride levels in water are, say, suboptimal. So they're trying to get fluoride into products we use on a daily. Okay. So fluoride in a toothpaste, that is one of the things that you need to look out for. Because now, you see, as we are chewing, as we are speaking, there's a process that our teeth undergoes called demineralization. That's like where a decrease in the levels of minerals in the tooth. But now when you have fluoride, say, in your toothpaste, when you're brushing, that period of time where there's contact between the toothpaste and your teeth, there's a process now called remineralization. What was lost is sort of being replaced. So it's important for you to look out for a toothpaste that has fluoride. There are also other products that have fluoride added into them. There's milk, there's salt, there's even other food products. But because toothpaste is a product ideally we should be using on a daily, then that's where you need to be keen to ensure that there's fluoride in your toothpaste. And even as we speak about kids, most people do not know actually that there's toothpaste that's different for kids and adults. And actually for kids, it's age specific. When you go to, say, even a supermarket or a pharmacy, you should be able to get an age-specific toothpaste.
So not using the same toothpaste for everyone in the family.
An age-specific toothpaste and an age-specific toothbrush. Because if you're using a toothbrush meant for adults on kids, surely you're doing an injustice to that child. And also the other thing that parents tend to overlook is the importance of dental care in children. Ideally, the first time you see a tooth popping up in your child's mouth, even before, you should already be doing some oral habits on them. Like even before a child gets teeth, they're already feeding. So what we advise is that you get, say, clean piece of cloth or cotton wool, soak it in clean warm water, then wipe the child's gums.
Oh, really?
Yes, that should be happening. And as soon as a tooth pops in the mouth, then you should initiate cleaning. You start it yourself, then as the child grows and the number of teeth increase in the mouth and they're able to brush on their own, then you can brush with them. What they see you doing is what they will be doing. If you don't start these habits early, then it becomes a bit difficult for them to pick up on them later.
If you're also slacking. Okay. So we'll actually be talking a little bit about brushing techniques in just a moment. But for now, Doc, I want us to get into common dental or oral problems, major issues that people deal with and that you see in your practice. Let's start off with the first one, which is bleeding gums. Wow, what is really the root cause of bleeding gums? When someone's brushing or flossing, they tend to see, okay, fine, I'm actually bleeding. What could really be the issue?
Yes, bleeding gums is actually one of the most common dental issues that you encounter every day. It's actually a sign of gum disease.
Okay, hold that thought for a second because I understand we've got John from Rongai on the line. Good morning, John.
Yes, good morning.
Good morning.
Yeah, I'm John from Rongai.
Yes.
Yeah, and the program is quite informative. I'm glad.
Thank you.
Yeah, I want to say hi to the doctor and ask two quick questions.
Yes.
One, I get some sensitivity while brushing my teeth.
Okay.
And I wish to maybe get to know what I can do to ease that. Number two, my front teeth, especially the lower jaw, the front teeth, around two teeth. Lower jaw, they are weak, though they don't pain. Nothing, I don't have any problem, but they are weak. They kind of shake. Kidogo too. They shake kidogo. I wish to know, is it much of a problem? What can do to maybe correct that? Maybe I'm worried it might get worse as time goes by. I'm around 36 years old. Those are the two questions I wish to know. Another quick one. I have a kid, 2.5 years boy. And yes, I always try to brush his teeth, but bad breath always comes. Even after brushing him, after hours, you get that bad breath from his mouth, and he's quite stubborn when I try to brush the tongue. So I don't know what he can do.
Okay, thank you so much. We will definitely answer those questions for you. Asante Sana John from Rungai for even just sharing his day-to-day experiences. Okay, so before we continue talking about bleeding gums, I understand we've got Mohammed on the line from Wajir. Mohammed.
Hello.
Good morning. Salam alaikum.
Walaikum salam wa rahmatullah.
Karibu sana.
Sasa shida yangu ilikuwa I have bad breath. Even after brushing for 3 or 2 times a day. And it's not going away. I don't know why.
Okay, thank you. All right, Asante Sana will answer that for you. Okay, so Here we've got John from Rongai talking about sensitivity in his teeth. He's also brought up the issue of his son having bad breath despite, you know, them having good dental practices. And the same thing is going on with Mohammed from Wajir. Okay, before we go back to bleeding gums, let's tackle bad breath then. Why not? Okay.
Bad breath is also one of the common issues that present to us as dentists. And bad breath usually has many causes. But most often, the cause starts in the mouth. Bad breath can be caused by decayed teeth, cavities, because essentially that is a tooth that is, for lack of a better word, rotten in the mouth. Right. So you could be cleaning, but you have a tooth that has a cavity, food has lodged there, decayed part of the tooth is still... Yes, there's a pocket actually, and a hole there. So imagine you have a tooth that has a hole. That hole is decayed tissue. Right. These food particles that stuck in there. You could be doing a good job with brushing according to, you know, but now if that is not taken care of, you definitely present with bad breath. Okay. If you have gum disease, which is common to majority of us, it could be as mild as, you know, just occasional bleeding gums, inflamed gums. That will cause bad breath. Okay. If you have, say, ulcers in the mouth that are unattended to, if you brush your teeth and you don't brush all of them, because most times people will do a good job with the teeth that are visible in the smile region, but the teeth at the back tend to accumulate a lot of that. So you could be brushing well, but not well, especially the teeth at the back. Right. So food particles and that's accumulated over a period of time. Then you could also have bad breath as a result of, say, infected tonsils. Oh, wow. Yes, infected tonsils that are unattended to will present with bad breath. If you have a flu, you have sinuses that are infected, you could present with bad breath. In some situations, also now the foods that we consume. If you're eating spicy food, say the people I know who chew on things like garlic, raw garlic. You chew on raw garlic, you didn't brush your teeth, chew on it again, take other things. I mean, you will definitely present with bad breath. So majority of the cases you're seeing, the bad breath is caused by the cavities in most cases. And let me say the bleeding gums. Yes. So what is causing our gums to get inflamed? Gums will get inflamed because we have not cleaned our teeth well. There's bacterial colonies that are still in the mouth in form of plaque. The soft, if you pass your tongue around your teeth and you feel like there's a soft layer on your teeth, that is what you call plaque. It will most often be there. But now if you don't clean that out, then you just create a microenvironment, which is like a dumping site for dirt and bacteria and all that. Wow. Yes. So all right. Needs to happen. Yes. Okay. So now you can actually see the importance as to why we definitely have to get a good relationship going with our dentist, and it's because of such conditions. We're going to take a short commercial break, but when we get back on the other side, we are going to be talking a little bit more about some of the common problems in regards to your teeth and your gums, and most importantly, how to work on your brushing technique. Daktari actually told me, believe it or not, you could be brushing your teeth all wrong. And so why don't you keep it K24, because when we get back, we will be showing you how to go about that. But keep talking to us on our social media platforms at K24TV on Instagram, Facebook, and Twitter.